We're here on the show floor at Insight Central. I'm Richie Jennings.
I'm Joe McKendrick.
And this is Tony Beaird. Hi, Tony. Tony is with the DuPage Medical Group,
yes.
and you're the Director of Infrastructure and Security.
Yes, over the last about 18 months or so, maybe 2 years, we've done about 20 to 25 new sites that we've built out. We acquired a rather large orthopedics firm to add to our group. So, yes.
Sounds like some integration, IT integration challenges.
IT integration challenges, personnel challenges, of course. We have to learn how everybody does the business when we acquire them. And there's always demands from the business on how exactly you're going to do something and or how fast you're going to do it.
Right.
Speed to market, so to speak, as they call it in some of the other areas of business, is pretty critical for us also.
And it certainly has to pay its way. And so I guess
Yes.
IT has to do more with less and faster.
Yes, and ironically enough, that's one of the reasons why we bought some of the products that we bought.
Okay.
We physically didn't have enough room to buy some of the things we wanted to, so we ended up having to go to basically a virtualized model for our business and all of our server and infrastructure. And it's been, the last 2 years have been a rather interesting run. We went from basically no virtualization to about 90 to 95% in about 10 months.
Did you throw away servers and
We did. We actually ended up moved to a whole a FlexPod environment, moving away from another set of servers to FlexPod.
So how are you liking that FlexPod?
It's rock solid. It runs.
Oh, okay.
The nice part is using virtualization. A server fails, generally we don't care. I mean, we do obviously, but it doesn't really impact business. And with the SAN on the back end, it just, again, as I spoke this morning to someone, it just runs. I don't lose sleep at night because it's not going to work. I don't sleep because of security. That's what's got me keeping me up at night. So yeah.
And security from the perspective of like HIPAA compliance and that sort of thing?
So we not only face HIPAA, but we also face PCI.
Given your rate of acquisitions, has FlexPod and the virtualized environment you have made those acquisitions much smoother and
It has. It has. One of the big things that almost all of healthcare in the United States uses Citrix as a front end to serve up applications. And before we did any of the infrastructure upgrades, we always ran into the problem of, hey, we've got to physically bring another server on board for Citrix. Now I can spin up a VM in 20 minutes.
Right. Is this a VDI environment?
No, it's currently it's all XenApp on the Citrix side, so we're serving applications from the data center. We're actually starting to do a VDI pilot now.
Oh, interesting.
We want to actually have some of our workers start working from home, and so we're moving into that model.
So working from home, is that the key driver for experimenting with that? Moving to that?
I think it's a combination of we want to be able to work from home, so it's a little easier on them, but it also is, at some point, you can only build so many buildings to house your support staff, and I think to some degree, you can rent, but it becomes painful to do. So if I can send someone home to work, I don't have to rent that space, or I can give it to another person and now get, two birds, one stone kind of scenario. I'm very interested to see how the hybrid cloud is really going to work, because I can see some benefit of doing that in our environment.
Do you cluster the FlexPods at all?
We do. We run cluster on tap.
And being healthcare, I imagine your so-called big data in quotes needs are a little bit different than other industries, right? So you have things you have to hang on to for the lifetime of a patient, right?
Yes.
It's not just cut off, get rid of the data after 7 years. You have to hang on to it, right?
We do, and it's funny. I had a conversation with someone about big data a little while ago, and what I struggle with personally, and this is more me than necessarily the industry, is I'm trying to figure out how we can implement a big data solution into our environment. The ultimate question I have is, for my environment, it may not be all of healthcare, is big data more of a solution looking for a problem in my building versus a problem that I ultimately have to solve? We're not a fairly large shop, relatively. We're not running petabytes of data, but majority, we run probably close to 30% of our environment is actually imaging data.
Gosh.
So
you need the capacity then.
Yes.
You need to be able to expand.
Yes. We're in the process of actually investigating kind of a tiered system, whether it's a separate SAN to put it onto or a tier within our existing NetApps. So we use a lot of the technologies that we brought in with FlexPod to do that. So we've virtualized our imaging system. We've also do a lot of SnapMirror and some other things on the back end to protect that data. But we've also looked at the app too and said the application can replicate. Let's let the application do it here, and then we'll protect it on the back end, kind of as a fail-safe. So we're using different pieces of our environment in different ways to accomplish the same thing. But I think that's the flexibility that we get out of it.
Listen, Tony, it's been an absolute pleasure.
Thank you very
Thank
much.
you so
I
much for
appreciate
coming
it.
and chatting to us.
Thank you, Tony.